Well, good morning. We're here in Olive Park, which is in the north part of Yonge Street, and I'm here with Councillor Joe Cressy, who's the chair of the Toronto Board of Health, and it is the third of our days of action, which is really the latest way in which we can encourage more people in Toronto to get vaccinated as we try to achieve our target. When I say try, we're going to achieve our target of having 90% of eligible Torontonians vaccinated. Why? Because this is the best weapon that we have against a variant, a Delta variant, and against COVID-19 itself, which you can see is still something that we're battling. Here in Toronto, you see it across the rest of the country, you see it in the United States. The pandemic is not over, but we have made very significant progress thanks to the fact that you, the people of Toronto, have gone out and got vaccinated. And in the early stages, it was possible for us to rely more on larger vaccination clinics that we had across the city. We still have some of those, and you can still go to one of those and walk in and get a vaccination. But now, as we get down to numbers that are closer to the finish line than to the beginning, we're sitting at about 80+% of people who have had one dose, and just under 80% of people who've had 2 doses. But we've got to get that last 10% done. So what are we doing? Well, we have the big vaccination clinics still open, but we've now added to that a total, for example, this weekend of 90 different clinics across the city that are in every place you could possibly imagine. Here we are in a park on North Yonge Street, and what we're hoping is that if you're out for a walk today along Yonge Street, that you will come by and just decide that it's time to get vaccinated. We have people here who can talk to you about a vaccination, can give you more information, can try to reassure you if you have any concerns about that. We will be sending, as we've been doing across the city, ambassadors out into the neighborhoods, along the sidewalks, to make sure that people, again, are aware of these opportunities that exist to get vaccinated. And it's not limited to these 3 kind of pop-up locations along Yonge Street. We have clinics as well in malls, for example. 4 of the biggest malls in Scarborough are being covered by our friends from the Scarborough Health Network and other partners that we have in the east part of the city. We have them in school properties. We have them in just about every place you could possibly imagine that is accessible to people, and that's the key. We are now trying to take the vaccinations out to the people to make it easier. We are accompanying the clinics themselves with ambassadors that are people that are from the neighborhoods in question, so that we can, again, provide that degree of reassurance, the degree of knowledge, just even the knowledge of the clinics themselves, which is very important to us. We are not going to fail at this task. We are going to succeed at this task of getting to 90%. It's a big number. It's a number that will put us in a class by ourselves in the world, but that is the way we would want it in the City of Toronto. And it's not just about numbers. It's not about numbers at all. It's about preserving the collective health of the people of the City of Toronto. The fewer unvaccinated people we have, the less chance that COVID-19 will spread, but also the less chance people will end up in the hospital. I'm fond of repeating some numbers that were accumulated between the 1st of May and August. And during that period of time, in the City of Toronto, 98.7% of the people who did end up in hospital were people who were not vaccinated or who were only partially vaccinated. We have seen over and over and over again, if you get vaccinated, you are far less likely to end up with COVID-19 or with any of the variants. And even if by chance, and it's a small chance, that you end up with COVID-19, you are far less likely to end up in the hospital or even worse. We saw in the last 24 hours a tragic tale of a young person who did have some other health complications, but who passed away in part because of COVID-19, under 10 years of age. We have people living in our city, in our midst, hundreds of thousands of kids who are back at school who can't be vaccinated yet. And so it is our obligation to make sure we protect them, we protect elderly people, we protect co-workers, we protect members of your own family by making sure that you come out to get vaccinated. And our job as a city, myself working with Councillor Cressy and others, is to make sure we have as many places as possible as close to where the populations are that haven't yet been vaccinated. So when you look around me in North York, for example, in these buildings that we're here at today, it isn't so much that the percentages are dramatically lower, but there are so many people who live in all of these buildings that there are substantial numbers of people who haven't yet got vaccinated. And we know most of them are not anti-vaccination. They're just people who need a bit of reassurance, who need a convenience to make sure the clinic is close by them, who need a bit of more information, and we're here to provide that. And so I would just say to people, please, think about this very carefully. Think about what you're going to be doing for your own benefit and for your own health. Think about what you're going to be doing for the collective health of the people of the City of Toronto. And think about what you're going to be doing as well for the schools and businesses. The best way we're going to keep the schools open, which we are very determined to do, the best way in which we're going to keep businesses open, which we're very determined to do, for the health and well-being of the children and for the health and well-being of all the people who work in those businesses and restaurants and so on, is to get people vaccinated, get to that 90% level so that we have a level of protection that is going to make sure that people don't get sick. I would just like to conclude by saying thank you, and I want to make sure I don't miss anybody here, but we have people that are part of a great team, and we've had health partners all the way through across the City of Toronto as we've executed this campaign to get to the places we are. You could be proud of where we are in terms of getting people vaccinated in this city. The numbers we have achieved, well up into the 80s of people with a first dose and just a hair under 80 now of people with a second dose. These are numbers that would be comparable and better to any global city in the world of our size and complexity. It's a great track record, and I thank you for that. But we haven't done our part as a city alone. We've done it with the healthcare partners from North York, and today we have North York General Hospital represented here. The Scarborough Health Network is putting on the clinics in Scarborough, and all kinds of other community organizations that have provided us with the trusted ambassadors that can go out and convince people that they should get vaccinated. This is important to the well-being of people, to the economy, to our city getting back on its feet. And so I just urge you to come by one of these clinics, to take the effort to seek them out. Look it up on toronto.ca and you'll find all the places, 90 different places over the weekend. Take somebody who's been hesitant, take somebody who doesn't have a ride, take somebody who may have just not had the time so far and get them vaccinated. So thank you very much for that. And I'll now answer any questions there might be.
Perfect. Mayor, I just want to learn more about the process behind choosing these specific locations. You mentioned there's 90. Obviously, that's a lot. So many locations. You mentioned many of them have low uptake of vaccination rates, and some of them are just here, like this one today, simply for convenience purposes. So just want to get a better sense of what went into choosing these particular locations where you've set up the Days of Action initiative.
I'll comment on this, and maybe Councillor Cressy would like to as well. There is nothing unscientific about this. Just as we have relied on medical advice in making the decisions we've made, all of the choices of all of these clinics is based on analysis of data. And the analysis of the data fits into two principal categories. First of all, the number and percentage of people who have been vaccinated, and conversely those who have not. And secondly, the likelihood of infection based on the history we've had with COVID-19 over the last 18 months. And so, in a nutshell, we've taken places where there is a lower level or higher numbers of people who are not vaccinated, combined with a higher likelihood of infection just based on the history of the pandemic, and picked areas where we then found locations that were either in a park like this, or in a school, or in an apartment lobby, or in a host of other places, including the mobile buses we've taken. And we take those buses similarly to places where people have not been vaccinated and where there's a higher risk of getting COVID-19. And we found that that is the best place to find the people who need most to be vaccinated, although anybody from across the city is welcome to come to any of our standalone clinics or anywhere else to get vaccinated. We're just trying to focus on the areas where there's the biggest opportunity to make the biggest difference.
So in the selection of these 90 clinics, the most we've ever operated on a weekend in the city, it's been a data-led approach based on where vaccine uptake is lower. And it's focused on both neighborhoods where people live, but also settings where people work and play and shop and commute. And so that's why you see many of these clinics in targeted neighborhoods in the city, but then you also see these clinics at subway stations, at local parks, in people's workplaces, at the mall, because we're targeting both the neighborhoods where people are, but also the settings where they work, where they shop, where they commute, and where they play. And so it's a data-driven approach, and this is the largest mobile clinic weekend we've had yet in the city. Days of Action is something that we're proud to be a part of.
Definitely. Just going off of that, it's the largest, mobile clinics on the weekend, and it happens to be taking place right before the vaccine passports roll out this week. Are you hoping that the vaccine passports, are you hoping to see a bigger turnout because of that? Do you think that is going to increase people's incentive for coming to get their vaccine?
I don't think there's any question but that the policies that are in place by employers the policies that are in place in public venues, whether it be sports venues or concerts, the advent of the proof of vaccination requirement in some places like restaurants will cause a lot of people who just haven't got around to it, or maybe they have a little bit of hesitation. We'll make it easy for them in subway stops, in parks, in apartment lobbies to get vaccinated. But I think the fact that proof of vaccination is going to be required will be helpful in that regard. And it's just good for everybody. So in that sense, it's not a matter of trying to make anybody feel bad or anything like that. It's a matter of having them understand that it's time, that we need to get these numbers up, and that's for everybody's health and well-being. And that's why I think this will be successful. But it's going to be a slower kind of success, a little less visible, but nonetheless, here we are, and people are going to show up and get vaccinated today, and that's all good news.
And just one last question. You mentioned, your main objective here is to, target people who may be vaccine hesitant, maybe aren't completely shut off to getting the vaccine, but just have some questions and concerns. So what are staff going to be doing today to talk to people and address that hesitation?
We're blessed to have here today, for example, and at all of these 90 clinics, healthcare professionals. And they can give people not the kind of misinformation and some of the rumors that they see on social media that may cause people to be hesitant, or even just a concern about, these vaccines because they're relatively new. But we have healthcare professionals who will say these are safe, these are effective. They can cite the numbers that say that you are way, way less likely to get sick or end up in the hospital if you get vaccinated than if you don't. And so they'll be doing that, as well as our ambassadors doing that. And I think that's going to go a long way to helping people who are a little bit hesitant. The fact is, as well, if we want to get to 90%, we have to do 300,000 plus more vaccinations. More than half of those people have already had their first dose. So we just have to get them to decide it's time to get the second dose and to get around to it. And sometimes that's as simple as what it is, getting around to it. And that's why we're trying to make it easy. So if you're walking by on the sidewalk of this park, if you're on the subway and you're getting off at your stop, if you are in the apartment lobby of your building, that you can get vaccinated, and if you just had those 160 some odd thousand people who've had their first dose get the second dose, we'll be a long way towards our goal. So we're working at all of those different groups of people, and we have, thank goodness, the help of a lot of healthcare professionals from North York, from Scarborough, from right across the city to provide the reassurance, provide the information, and of course do the vaccinations in that professional way they've done throughout.